Hi, my name is Rebecca. I am a pelvic floor therapist here at Solstice. Today I'm going to go over bladder health and what is normal for peeing and fluid intake, just because so often we have patients who pee too frequently and most people don't even know what's normal or how much water they should be drinking, how frequently they should be peeing. So for peeing, you want to pee every 2 to 4 hours, and you want to be able to sleep through the night without waking up to pee. If you have a medical condition, you're pregnant, you're over the age of 65, in those scenarios you may pee more or you might be peeing in the middle of the night. And so if you're peeing every 2 to 4 hours, you should be peeing about 6 to 8 times within that 24-hour period that if you're not waking up at night. You want a steady stream without discomfort. You don't want to push and you don't want to strain to get that urine out. You're going to just take your time, sit on the toilet, butt planted, feet on the ground. With that in mind, you don't want to hover even when you're in public. If you are at a bar and there's pee all over the seat, or you're using a porta potty, those are times where I will let you hover. But for the most part in your day-to-day, you really want to sit flat. The reason why is about your anatomy. So your bladder is a muscle, your detrusor muscle, and then you have your pelvic floor. Throughout the day, your bladder muscles relax so that you can fill up with urine, and then your pelvic floor is just like slightly engaged. When you go to pee, your pelvic floor muscles need to relax all the way, and that will let the bladder muscles squeeze and contract. So they work in opposition. When you're hovering over a toilet, so you're like hovering, your glutes are engaged, your pelvic floor is also gonna engage, and then you'll notice you actually have to push to get that pee out. And that pushing, then you see that pee spreads all over the toilet. So if everyone just sat down, the toilet seat would be clean. It would not have any pee on it, and then we could all sit in peace. If it is dirty, if you are an absolute germaphobe, bring those little like wet wipe packs, just wipe it, throw it out, put toilet paper, sit. If not, just put toilet paper. I just say make your own throne, like you're the queen, sit, or king, and then sit, butt down, feet down. For peeing, you also want to not continuously ignore that urge. What will happen is if you keep ignoring it, you keep holding your urine, especially I'm talking to teachers, nurses, doctors, anyone who it's hard for them to escape their job, moms even, to go to the bathroom. Because what happens is this will start to stretch, and then it becomes harder to pee. Usually these patients we end up seeing for urge incontinence later. Another thing that we see a lot is something called just in case peeing, jicking, or preventative peeing. And these are people who they leave their house and they pee, they get to work and they pee, they go to pick up their lunch and they pee before, and they're just always fearful that there's not going to be a bathroom, and so they're always peeing preventatively. But this also trains your bladder to think, oh, my human likes when I'm peeing when I'm halfway full. Next time when I'm halfway full, let me tell my human that I feel like I'm full, that the whole bladder is full. And so this ends up tricking you, where your bladder is telling you to pee more frequently than you actually do. So we recommend that, let's say you want to throw a car ride, or you're going to the movies, those are okay times. After sex is an okay time. But if you're, let's say me, I wake up, I pee, I get ready, and I go to work, I don't pee right before because I probably peed within the hour, and then my commute to work is 15-20 minutes. If I need to go, I can pee when I get here. So there's just no reason in most places, unless you're kind of driving for long periods or something like that. So for urges, what usually happens is you get this first urge, and usually you're about halfway full. And for most people who don't have a dysfunction, you don't even really register it. Maybe I'm with a patient, I kind of feel something and I just ignore it. Then you get a second urge when your bladder is closer to being full. And that urge is usually okay, Rebecca, like the next time you can't go to the bathroom, go. It's never like urgent that I think I need to run, but I just think, okay, when I'm in between patients, I will go. Talking about all of the bladder urges, urgency, when you should be going, something really important to talk about is fluid. Some people completely just don't drink fluid. Some people avoid drinking fluids because they think that'll make them pee less. It actually concentrates your urine more, and that in itself can irritate your bladder lining and make you feel like you have to pee more. Or there's people now who are just drinking these like gallon water that's just having you chug water, you also don't want to do that. If 2 people, let's say, are given 20 ounces of water and one person drinks that in an hour and one drinks over 4 hours, let's say, the person who chugs that water in the hour will pee more frequently than the other person. So you want to sip water throughout the day and avoid chugging it. And then for amount of fluid, generally we recommend that you take half of your body weight in ounces. So if someone weighed 100 pounds, they would drink 50 ounces of fluid a day. And then you want 80 to 90% of those fluids to be tap water, or not tap water, just flat water. So that means that, let's say when you wake up, I always recommend having coffee first because you've been dehydrated at night. Water first, then have your coffee, then you can have water, and then in the afternoon, if you want a soda, sparkling water, have that. But try not to only be drinking coffee, sparkling water, soda, things that could potentially bother your bladder. Another thing that can be causing frequency is constipation. So right next to your bladder is your bowel, and so if you're full of stool, your bladder is going to be smushed and make you feel like you have to pee. So if you have constipation, take care of that. Come in, we can help you with the constipation. And in our next video, I'll talk about how to delay those urges. Let's say you implement all of these strategies, you're having water, you're not chugging, you stop it just in case peeing, but you're still peeing all the time. Watch the next video and I will go over how to start to delay those urges.